Welcome back to my channel. I'm going to be trying to summarize a few different things that we can, I suppose, discuss about this current situation with regards to COVID-19. I will try and link the resources that I've ascertained some of this information from. So if you would like some more information, perhaps the reasons why I'm talking about the things that I am, I've got the kind of evidence to back it up, and I'll do so in all my future videos as well. I want to make it clear that this is as, I suppose, theoretically backed as possible, and isn't. I'll try and keep some of my insights, or rather I'll make it clear that my insights are my own, and the research that underpins it will be referenced as necessary. So COVID-19 has brought on quite an unprecedented time in terms of dealing with, I suppose, our environment, but also our own mental state as we try and attune to the changing in the environment. The most recent policies implemented by many of the Western governments, including the UK where I'm from, is social distancing, and actually that's being enforced now. So it's kind of mandatory to only go out for the essentials and to exercise, I think, once a day. And I think it's bringing along with it a lot of questions. How are we going to manage with this? Is the economy going to stand up? Am I going to become ill? Is my family going to become ill? What can I do to take all of the necessary precautions, but also, I suppose, manage my own state of being at the same time? These are all good questions, and I think the kind of things that we're going to need to start asking ourselves perhaps is, what are we able to manage at the moment, or rather what can we do practically that's going to allow us to kind of reconcile some of that anxiety, and what can we do to let go of the things that we can't change? Because much of those kind of hypothetical questions that I just asked are, the clue is in the name, they're hypothetical. So we are going to struggle to solve these problems that aren't, I suppose, practical or clear-cut in the way that we can move forward to solve them as an individual. We talk about this a lot in cognitive behavioural therapy, the difference between a practical worry and a hypothetical worry. And it can be quite difficult to distinguish between those. So I'll be going through a few different things that we can do to kind of relinquish these hypothetical worries. There's a great kind of summary of what people can be doing at the moment by Dr. Russ Harris, which I'll link below. It's called the ACE model as an acronym, and the A stands for acknowledging. So what we need to do is we need to be able to say that this feeling that we're experiencing, this uncertainty, this anxiety, it's okay to experience, because we're all experiencing it in our own way. Some more than others, certainly, but this is a global phenomenon, and it's something that we're all having to deal with, and it's very much okay to feel unsettled by it. And there's a lot of power, and Dr. Harris explains it in the kind of rationale that he writes up, that it can be very powerful to just say that it is okay to ourselves, and you're showing ourselves some self-love and saying that it is okay to feel this way. So that's the A. The A is to acknowledge the feeling. The C is to come back, so to come back into your body. Practice some kind of self-soothing techniques. Anxiety loves to run away with the what could happen, and kind of spiraling into the future, going through the different hypothetical scenarios that we can do. We're very intelligent creatures, and we love to, I suppose, imagine these circumstances where things could go horribly wrong, and how would I cope with it, because that allows us to experience more control over that situation. What's important, though, is that our feelings find it very difficult to distinguish between what's real and what we're imagining. So if we're continuously imagining the worst possible scenario that's going on, it can be quite difficult to come back to reality and say that that's not what's happened, because our feelings are very, very powerful and very overwhelming when it comes to trying to discern logic and emotion, and it takes a lot of practice to do that. I personally believe that the cognitive behavioural therapy model is allowing us to, I suppose, have some choice about when we are overwhelmed by our emotions, and when we can step back and choose the practical side, and be able to get into that logical headspace and say, okay, what can I do there? What could I do differently? It's a kind of pragmatic approach to reasoning. So checking on yourself, checking on your breathing, bring yourself back to the present. I think just taking a deep breath in and out can be extremely powerful. If you know any other kind of mindfulness meditation, it can be very helpful to do so. Just watch how you're breathing. So we tend to like to shallow our breaths a lot when we're feeling anxious. So just make sure we're getting enough oxygen in, and remembering that this will all pass. We are it's a very uncertain situation, but there is humanity has certainly dealt with far worse, even over the last 100 years. So this is something that we can manage. It's just something that's very new and then very scary as a result of that. So the E stands for engage in what you're doing. There's a really handy attention training resource that I was given by a colleague of mine where I work within the NHS and the mental health service. He's a high intensity therapist who's said he's found a surprising amount of use from just the sitting and listening to different areas, and perhaps paying attention physically and viewing different areas and really focusing in on what's going on there. It can have quite a profoundly, I suppose, relaxing, or just a cathartic effect perhaps on if you're feeling very anxious, just being able to refocus yourself. I'm quite interested in mindfulness and meditation, and I found it extremely helpful in managing my own anxieties in the past. And that's in no small part due to the shifting away from our own preconceived notion of what reality is at the moment and coming back to what actually is. And what actually is, you know, we're here, we're sat here, we can feel that we are breathing, and we can experience what is in our immediate surroundings. In CBT, I should really always preface what I'm going to be using for these acronyms. Cognitive behavioural therapy, CBT, that we talk about the kind of 5 things. So list 5 things that you can see, list 4 things that you can hear, list 3 things that you can touch, list 2 things you can smell, and 1 thing that you can taste. So just really bringing yourself back into what's actually here at the moment. That's quite a powerful effect for people. We also have kind of the fundamental framework of cognitive work, cognitive behavioural work rather, is to understand the way that we are seeing the world in 5 areas. So we have the way that we think, we have the way that we feel, that's physically, the way that we feel emotions, the way that we behave, and the situation that kind of underpins, so the trigger perhaps, or the external circumstance that might influence these other areas. So these are all these 5 areas. The way that why it's helpful to conceive the world in this way, and why it's especially important when we've got this external circumstance of the COVID-19 situation, is that we're not able to change this. There are practical things that we can do, which I'll move on to shortly, but as a whole this is something that's going to have to play out. So what we can do is, although we can't change things like these 2 in the middle, these feelings, so how we feel physically, how we feel emotionally, just by saying, you know, I'm not going to feel this way, it's not very helpful. If a therapist ever told you that, they shouldn't be in the job, because it's not a useful way to move forward. I think there's quite a funny sketch that I keep being reminded of. I'll try and link it down below. A psychiatrist said, just stop it, just stop it, stop feeling that way. What we're looking at is to work with the other 2, so the behaviours and the thoughts, because although challenging, we are able to change how we think, and we are able to change how we behave. That's a kind of summary of what we do within cognitive behavioural therapy. But the reason I think that's especially important now is because when we know the kind of thoughts that are going on in our minds at the moment, perhaps the ones that are spiralling around in our mind, almost the automatic thoughts that are going on, we've got kind of more of a hold on them, and we've got more of a hold on the behaviours that do and don't help us. A lot of us are experiencing a lot of free time right now. I'm sure there are many of us that aren't, but a lot of us do have extra time now, and there may be a lot of things that we enjoy doing, and there may be a lot of things that we don't really want to do, and being able to manage those to ensure a kind of healthier overall state of being is very, very important, and knowing how these affect our feelings can be very insightful. I'd just like to touch on the physical side of things, especially because there's a lot of apprehension at the moment going on about how we're feeling internally. So if we are focusing a lot on the body at the moment, it can cause a greater feeling of anxiety, because we start to focus in on, you know, am I feeling digested? Am I actually ill? What's going on with me? Really focusing in on that physical feeling there, and that can actually enhance it. Attention is very powerful, and if we do focus in on these feelings, we can make them more powerful than what they are. So attention training is very useful to manage are present in, I suppose, the wider sense, not just saying, am I tight-chested? I've had quite a lot of people come and ask me about this, and what kind of things they can do to manage with that, because they're feeling quite tight-chested all the time and they think that they might be ill. So all I would say is that to always take caution rather when you're having any issues with feeling physical symptoms, but it may just be that it's within these 5 areas again. So it may just be that your thoughts and your emotions, just the general anxiety around the situation, could be contributing to, because these are all interlinked. So these are all interlinked, these 5 areas. So your thoughts and your feelings of anxiety around the situation could be contributing to these physical symptoms. So it could actually be enhancing any, however slight physical symptoms that you might have, and expanding them out so it feels very overwhelming. It feels like you really could be ill. What I'd like to say is that that's quite normal, and this is what tends to happen when we are in a situation of such uncertainty. So just kind of test it is what I would say. See how you feel when you're engaging in an area that you enjoy. See how you feel when you're engaging in an area that immerses you in that experience, and I suppose make an active effort and say, how am I feeling right now? Because you're not going to be thinking about how you're feeling, you're immersed, but make an active effort to say, how am I feeling? And if you're not feeling very tight-chested at the moment, if you're not feeling the physical symptoms as much, then hey, that's a better indicator that it could be anxiety. I've got an anxious cat here that wants to come out. You know you've got a door. You know you do. Okay, go on.